And if you're a back surgeon, you consider it a back muscle, but we know that it plays an important role in pitching. But it's been kind of recent where we kind of realize where it is really critical. And then we've also noticed that when the lat is injured, it's not that unusual for the teres major to also be injured in some of our athletes. And in non-baseball sports, we actually see these teres problems quite regularly, some of our weightlifters and others, and the two of them can go together. And so the teres is right next to the latissimus. It's a much shorter tendon, thicker muscle. And I think many times when we look at the initial MRI, when we think there's a lat tear and we see some separation, there's a lot of fluid there, and you say there's a muscle tendon junction rupture, it's often the teres is involved too. So just keep that in mind. And this really started my journey. Jake was throwing the ball and he stopped and he just walked off the field. He was done. And he reached underneath his armpit, and one of my partners called me and said, "Hey, have you ever seen a lat tear in a professional baseball player?" I don't know what that is, but that's where it looks like he hurt. So, we had heard about it. Dr. Schickendance and others had published it. But this was unusual to see it acutely like this, and we weren't sure exactly what we were going to do. And as you can see, they're able to finish the throw. So when your elbow goes out in the middle of your throw, the ball goes high and wide. But on a lat tear, they're usually able to finish the throw because it's at the very end when they're decelerating where the tendon will pop off. So eccentric load, decelerate the arm, and that's where it comes out of play. And you'll see the swelling or ecchymosis in the armpit as you see here. The examination, palpation, they usually don't have neurologic symptoms. Many times you'll hear people say he has like a triceps tendonitis because of the proximity of the triceps